Good morning and welcome back to GP Video Podcast by Nadia. So I just wanted to make another quick video on my way to work, and that is what is about the concepts of false positive and false negative. Some of my relatives and friends and patients always ask me that why can't we do all the cancer markers once in our lifetime, and if they are negative then we should just be contented that we are not going to get any cancers. So when I started my general practice, I used to do all the known cancer markers on my patients who were asking for it, that we want to screen for cancers, or if we have family history of ovarian cancer, prostate cancer, breast cancer, all of that. And I used to do a full panel of cancer markers that I knew about. When I spoke to my other senior GPs, and then when I attended a few seminars and webinars and workshops, I came to know that it is not a good idea to be doing cancer markers routinely on all patients, or on all the patients that want me to do it. Reason is false positivity and false negativity. What is a false positive result? A false positive result is a cancer marker being positive while it is not showing cancer. Because as we know that cancer markers can be positive not only in those respective cancers, but also sometimes are up or down because of some other inflammatory or infective processes going on in the body. So that is false positive. And what does false positive result do? It actually gives patient a lot of apprehension, and that happened to one of my patients. So in her case, one of the colorectal cancer markers was high, not too much high, but just a bit high, and that actually caught us off guard because we were not expecting it to be high. And then I had to repeat that blood test a couple of times, and then all the other blood tests and the scanning and all of that, just to see whether she's at increased risk. But that was, as I said, it was a false positive result. The other one is false negative. It means that you are at increased risk of developing that cancer, but the cancer marker is negative. So now I will explain what are these markers about. These markers are used when you have been, or not you, I mean when anyone has been diagnosed with cancer, unfortunately. These markers are used for the prognosis of the cancer, like how is the treatment going, what are the chances of getting better, and measurements like that. So when a cancer has been diagnosed, then those markers are used every few months to see how is the treatment going and what is the prognosis of that cancer. There is only one test, that is a blood test, that can be used to find out whether that cancer is present in the body or not, and that is called prostate specific antigen, and it is used for prostate cancers. So when I attended this GP24 conference, in that the screening procedures were also mentioned, and the screening, what are the new new updates on the screening procedures, and they were like, PSA was not one of those routine tests that GPs would ask the patients to do. But now, because there have been so many cases, there has been a rise in the prostate cancer. Now anybody who has got males who have got family history of prostate cancer, or anybody who comes like for a 45 to 49 years old assessment, GPs can discuss and should discuss PSA with their patients. And if they are interested in doing that PSA, I do it usually on all my patients who are above 40 or who have family history, so even in their 30s, and I always ask them, take their permission and go for it. So PSA is one of those screening blood tests for cancers. Otherwise, all the other cancers have other screening. So screening is what we can detect cancers in. So breast cancer has got a screening called mammogram. Anybody above 45 years of age, all the ladies should get mammograms every 2 years, while those who have got increased risk or they have got the family history, they can go then for blood genetic testing. That is another thing, which is a blood genetic testing for that's not the cancer marker, that's the blood genetic testing, whether you have genes in your family, like whether you have the genes that your family, for example, your grandmother got it, your mom got it, or any first degree relatives or second degree relatives got it. So you can go for BRCA gene testing and other gene testing. Similarly, there are some genes in ovarian cancer as well, but that is not the cancer marker, that is the genetic testing. But the screening test for breast cancer is mammogram every 2 years, but the ladies who are at increased risk, they get bilateral breast ultrasound scans and mammograms from an earlier age as well, or it could be yearly as well for them. Then for cervical screening, we have got pap smear or cervical screening test. Then for colon cancer, we have fecal occult blood test and colonoscopy. So all of these are different screening procedures that we get after a certain age, and depending on your risk, maybe earlier than that. But cancer markers are only used for prognosis, and apart from PSA, which is the one which we can use for diagnosis, otherwise all of them are used for prognosis because of false positivity and false negativity. Thank you so much. Bye bye.